Hello, my name is Matt Blanton. I'm a plastic surgeon here at Specialist in Plastic Surgery, and I'm here to chat with you about the Vectra imaging and how it's important in my rhinoplasty consults. When patients come here for consultations, part of their experience with the consult is that they get to see before and after photos of the particular surgery that we go through. And what's unique about the Vectra imaging is that you actually can then do an image of yourself, and I'm able to end up morphing the image to hopefully reflect some sort of result that you're happy with. So the Vectra imaging is really just a 3D picture. There's multiple digital cameras that project a high definition image of your head, and it can also be used for the breast, for mastopexies and augmentations too. But for rhinoplasties, it's really just for your face and head. And what that is able to do is that we can transfer this into your consult room, and I'm able to end up showing your face while we end up doing the rhinoplasty consult. And the reason why we end up doing this, or why I like doing this, is that from an imaging standpoint, I can end up morphing your nose and change some of the aspects of the nose that you dislike, and I'm able to end up doing this and basically while you're here in the consult, and it allows me to be able to figure out what your expectations are and to see if I can deliver that by showing your before and after. So I'm going to show you a patient of mine that came in that was complaining that she disliked her tip of her nose and also dorsal hump, and I'm going to show you how the Vectra imaging can end up being morphed to basically her liking, and she ended up having surgery done, and I'll show you before and afters after that. So patient comes in, gets the photos taken, and basically what's nice is that I can kind of flip the head around and be able to show you different angles of where the nose and be able to show kind of different views that you would not normally end up looking at yourself. So I can end up doing up top, I can do from the front, and I can end up doing from the oblique. And all those show just different aspects of the nose that when I end up changing things, it ends up helping. So for her main issue was she didn't like the hump, and she didn't like how big the tip was. She stated that the nose was close to what her grandfather's nose was, and so she wanted that to end up being morphed. So just while the patient's here in the consult, I basically tell them all right, let's wait this out for a second while I end up morphing your nose, and I'll do this kind of in real time to end up showing what I can end up delivering in the operating room. And then from the top, let's see. So I've already did the dorsum part. Now I'm just working on the tip, and then I'll show you the before and afters here in a second. All right, so right away we can review the results. So basically from starting from the side, so this patient did not like her dorsal hump, so this portion of her nose. So this is her before I end up doing the morphing, and this is after. So again, it's gonna have to toggle back and forth before and after, and she gets to see, for her, she wanted just a slight slope to her, so she didn't want something that was very angled and didn't want a severe slope. So I show the before and after on the lateral, then I go to the other side. This is the before and after. So there's definitely improvements in what the dorsum's like. From the front, she didn't like the tip, so this was her before. So she has the tip cartilage here. The lower lateral cartilages are a little wide and splayed out. So by shrinking those down using this little toggle, I'm able to end up getting to a tip result that she would like. You can definitely see this more when the nose is kind of turned up like this. So naturally the nose is supposed to take on a little more triangular shape. For her, it goes up and then plateaus and then comes back down again. So with morphing the nose, it takes a little bit more of a triangle instead of a flat top, so more of a triangle shape. And then you're able to view this from the top view as well, so you can see that from before and after how much the tip has changed from before and after. And so when I do this, it allows me to end up figuring out, all right, sometimes the patient doesn't want to end up having the tip so small, or sometimes they don't want to have the dorsum as sloped as it possibly could be. And so it allows me to kind of set in the operating room, all right, this patient wants to have certain expectations, and it really, really helps from an expectation management standpoint. So it allows me to end up delivering the results that makes the patient happy, and then ultimately ends up making the patient happy because they got to see their before and afters kind of in real time. So this is her in the morphed view. So this is her after the morphing. So I'm going to end up showing you the before and after. So this is her view up top. So this is prior to surgery. So she has the widened tip. You can see it more on the oblique section. And then you see her hump here. This is her after photo. So now she has a lot smaller tip. She has a good dorsal aesthetic lines, a nice dorsal slope, and her projection was improved a little bit. That was one other thing that she disliked. She did have one little lesion here on her nose that she wanted that removed, and so that's the reason why you don't see that. Overall, very happy patient. This is 3 months out.